In this video, I'm going to differentiate between the internal and the external hemorrhoids in terms of their embryonic origin, blood supply, as well as the innervation. Now, hemorrhoids are normal vascular structures that are found in the anal canal. So on the left side of this image, you will see the normal hemorrhoid structures. But these hemorrhoids can become enlarged and swollen with conditions like, for instance, advanced age, prolonged sitting, or straining from chronic constipation. And so therefore these hemorrhoids can start to become symptomatic and starts to bleed. Now on the top part we have the internal hemorrhoid, which is above the pectinate line. So anything that is above the pectinate line is deriving from the endoderm. While here we have the external hemorrhoid, which is below the pectinate line, and thus it's derived from the ectoderm. Now in terms of the blood supply, the internal hemorrhoid is being supplied by the superior rectal artery, which is a branch of the inferior mesenteric artery, while the external hemorrhoid is being supplied by the inferior rectal artery, which is a branch of the pudendal artery. And then in terms of the innervation, the internal hemorrhoids are being innervated by the hypogastric plexus, and thus it's painless, while the external hemorrhoids are being innervated by the pudendal nerve, and so therefore external hemorrhoids are painful. Alright, now with that information in the background, we can go through this table and fill that out. So the classification of the hemorrhoids, if it's above the pectinate line, then that would be an internal hemorrhoid. And that internal hemorrhoid innervation is from the hypogastric plexus, which is painless. And the blood supply is from the superior rectal artery, which is a branch of the inferior mesenteric artery. Lymphatic drainage of the internal hemorrhoids is into the internal iliac nodes, and the embryonic origin, since it's above the pectinate line, is from the endoderm. And so therefore, since it's derived from the endoderm, the type of cancer that can develop in this region of the anal canal is an adenocarcinoma. On the other hand, it's the external hemorrhoids that are below the pectinate line, and their innervation is from the pudendal nerve. So therefore the external hemorrhoids are painful, while the internal hemorrhoids were painless. Now in terms of the blood supply of the external hemorrhoids, they are being supplied by the inferior rectal artery, which is a branch of the pudendal artery. Its lymphatic drainage is into the superficial inguinal nodes. And then its embryonic origin, since it's below the pectinate line, is from the ectoderm. And so given that it's arising from the ectoderm, therefore the squamous cell carcinoma is the type of cancer that can develop from this region of the anal canal. Now one question that I would like to ask you is that what type of hemorrhoid is associated with the portal hypertension? So if a patient has portal hypertension, what type of hemorrhoid can develop in that patient? And the answer is internal hemorrhoid. So the drainage of blood for the hemorrhoid above the pectinate line is via the superior rectal vein, and superior rectal vein is part of the portal venous system. So due to the portal hypertension, these patients can develop internal hemorrhoids. And then I would like to quickly summarize the other veins that are being affected by the portal hypertension, and these include the caput medusa due to the distension of the paraumbilical veins, as well as esophageal varices, because the left gastric vein is part of the portal venous system, and left gastric vein is connected to the esophageal vein, which is part of the systemic venous system. So due to the distension of the esophageal vein, patients with the portal hypertension can also develop esophageal varices. So just to summarize, superior rectal vein, paraumbilical vein, as well as left gastric vein are all part of the portal venous system. And then I just told you that the left gastric vein anastomoses with the systemic venous system via the esophageal vein. I would also like you to know that the superior rectal vein connects to the systemic venous system by the middle and inferior rectal veins, and then finally paraumbilical veins connects to the superior as well as inferior epigastric veins. So these veins are part of the systemic venous system, while the superior rectal vein, paraumbilical, and left gastric are part of the portal venous system. And thus, due to the portal hypertension, since the superior rectal vein is being affected, these patients will develop internal hemorrhoids. And that concludes our discussion.